My name is Anna. I'll be your occupational therapist for today. How are you feeling?
I'm feeling okay. Out of breath, but okay.
Okay. So today I'll take you through some breathing exercises. So that way when you do feel that sense of fear because of your COPD and you're trying to do functional activities, it's going to be a lot easier. We're going to slow things down. I'll take you through 3 different things that you can do while at home because I know you want to get out of the hospital quickly. I totally get that. So we're going to get you from your bed into the chair. I won't make you talk that much today because I know that's going to stress you out even more, and you're not going to want to exert that much energy. But before anything, we're going to do a few things. So first off, what I want to do is assess for any pain that you might have. So do you have any other diagnosis that I should know of besides your COPD?
No.
Okay. So the first thing we'll do is I'm going to take you through the visual analog scale is what it's called, and it assesses pain. So it's right here, pulled up on my laptop for you. And all you have to do is, actually, if you want, you can just point to the number. So it's the scale of 1 to 10, and then if you do have any pain, I want you to tell me the intensity of it, the location, how long you've had the pain, anything like that. Now I know that your issue mainly is your breathing, but I just want to see if there's anything else that I should know about before we get you up. So if you want to point to, there's also underneath the scale, if you'd rather do a face that shows like your pain better. So scale of 1 to 10. So just a little bit?
Yeah.
Okay. So that's not a huge thing to worry about, so that's good. So I'm glad to hear that. How are we doing so far?
Good.
Okay. Just want to make sure. And so you are on 4 liters of oxygen, it says?
Yep.
Okay, so when we do move, the one precaution I have is we don't want to get any of the wires tangled or in the way. So we'll just say that she has the nasal cannula on, and so I want to make sure that it's not getting caught in anything and everything like that. So with COPD, we're actually going to want to prop you up even more than you already are. So I'm going to grab another pillow here. And the reason for this is when you're lying flat, or the flatter you are, there's going to be more stress on your lungs. So this might not be the most comfortable position, but if you can sit up for me, I'll quickly put this back behind you. Do you feel a little bit better since you're more seated, like higher up?
Yeah.
Okay, good. Okay. So I just want to be sure that everything's still okay before we move. So we're going to start off with testing your oxygen saturation, so the oxygen levels in your blood. So I'm just going to take your finger here. And this should go pretty quick. And we'll see what that reading is. It also determines your pulse rate, heart rate. So for right now, 98 oxygen saturation, so that's perfect. That's what we want to see. Heart rate is a little bit high. Is that usually what your heart rate is? Do you know?
Yep.
From nursing? Okay. Alrighty. And then I would do blood pressure with her. I don't have a blood pressure cuff, but so I'm just gonna, okay. So let's just say that's blood pressure. Okay. And so your heart rate looked pretty high. That's the only thing that I think is, so everything else looks good. We did the pain, we did that. So now this part is going to be really important to know. I'll probably give you a handout of these exercises so that you can do them at home as well. The first breathing exercise, and I'm going to pull up a picture for you so that way we can go through it together. You still feeling okay?
Yep.
Okay, so the first one is called square breathing. And as best you can, on the count of 4, and we're going to go in kind of like it's a pattern. So first it's hold your breath, then you breathe out, then you're going to hold your breath again, and then you breathe in. And the count of 4. So we'll do it together. Do you feel up for this?
Yeah.
Okay. So first we'll hold our breath. So breathe out. Hold it again for a count of 4. Breathe in. Do you want to do another one of that, or do you want to do another kind of breathing exercise instead?
We'll do another one of that.
Okay, so hold your breath. Breathe out for a count of 4. Hold your breath again. And breathe in. Nice deep breath in. Good, that looks good. We'll do one more before we try to move you to the chair, and I have it nice and close so you're not going to have to move that much at all. And then I'll take you through some energy conservation tips and techniques. For pursed lip breathing, so the picture here, relax your neck and shoulder muscles for me. Okay, so you're relaxed.
Yep.
We're going to breathe in for 2 seconds through our nose, and you keep your mouth closed. So after that, breathe out for 4 seconds through pursed lips, so this is what it looks like. And if this is too long for you, you just simply breathe. Don't worry about the pursed lip. So we'll do it again. Breathe in for 2 seconds, and then for as long as you want, forever, for whatever feels right for you, for the breathing out part. So one more. Okay, very good. So we'll stick with those two for now. Okay. Do you feel like you're ready to get up and out of bed?
Yep.
Because I know that was your goal for today. Okay. So I'm going to kind of help you out here. When you're at home, your husband or anybody else can help you with getting out of bed, but we're going to work on this more to where you can get independent with it. But so for now, I'm going to take your leg off the side, give you a little rest in between. So, okay, I'll slowly bring the other leg over. Okay. Alrighty, so now we're going to lift up. Okay. Okay, can I have you scoot more towards me? As far as you can. Alright. Do you feel like we need to do any breathing exercises now, or?
Nope, I feel good.
Okay, now I'm going to check your oxygen level, so I would check that on the nasal cannula and her oxygen. Okay. So I am going to place this gait belt around you, not super tight because you do have the COPD, you do have the breathing problem. This just provides me with a little bit more stability. I just want to make sure that you don't fall, you're not at a risk of falling when we do move to the chair. You still feeling okay? Not any dizziness or nausea or?
Nope. Feeling good.
Alrighty. Put that through there. Just so I have something to kind of grab onto if I need to. Okay. Alright, so now we're going to, feet are kind of as close as they can be on the floor.
Yep.
Perfect. Okay, so we're going to stand up. Okay. I got you if need be. And yep, just sit right down. Okay, so how's that feel? Moving positions.
Good.
Okay, perfect. So now that we're seated, I know how badly you want to get home and be independent. So we're going to go through a few things that you might have to do at home. So since we're in the hospital, it's going to be a little funny because obviously you're going to be doing these in rooms of in your house. But the first task today that I have for you is folding some laundry. So we're not going to give you a whole lot to do. But when you go home, if you want to keep like a stool or like a chair of some sort, like maybe in your closet where you get your clothes down from to be ready to fold or whatever, you know, work with. Or if you have a laundry room, keep it in there because we don't want a whole lot of movement. Also, I would recommend probably like a rolling laundry bin so you don't have to lift anything. Because some of the precautions with COPD are going to be lifting, pushing, pulling, doing a lot of household tasks at once. So if we can kind of create a schedule and break it up throughout the day, you're going to be less tired, more prone to be able to actually do it. And when lifting any object, exhale while lifting if you really have to. So just breathing in, breathing out, just remembering those kinds of breathing techniques. So that would be the precautions that I would have for you.
Okay.
What kind of chores do you do at home? Like, do you do a lot of household tasks?
Normally I'm the one who cleans the house.
Okay. So maybe we'll have to educate your husband as well on ways to just kind of know when you're having trouble. And we'll also teach you how to recognize those kinds of things as well. So right now, do you have anything that kind of lets you know that you might have some shortness of breath or...
Nope, I don't know yet.
Okay. Alright, so yeah, I'd recommend the wheeled laundry bin. No large loads of laundry. Of course, you want to just break it into small tasks. Do the lighter things first. So that's why today, to start out, I only have just a few pairs of socks that I know that you needed washed or you needed to tend to, and then a t-shirt as well. So we'll start out, and like I said, I recommend you do this seated at home. So there's the socks for you. We have a few pairs. Okay, and let's pretend this is a wheeled laundry bin. So we would just have it there, probably close to you. And then also, if you find that you do laundry like often at home, maybe try to just make it like once a week. I know I do laundry once a week, and it's just better off that way, so you're not so tired out from doing it constantly. So that's common sense stuff. So yeah, just when you're at home, like, ask for assistance if you absolutely need it. Don't be afraid of that. We just want you independent as possible. So how do you feel after that? Do you feel like that was a pretty simple thing?
Yep, I feel pretty good, and you telling me to exhale out helped a lot.
Okay, good. Glad to hear that, Sue. Okay, so now we're going to move into a grooming task. So I'll take all your folded laundry here. So now you got some new outfits to wear in the hospital. Okay, so grooming tasks. Again, it's kind of silly that we're doing it in the bedroom area, but at home, again, like a stool right there by your sink, just keep it there so that when you're doing this kind of stuff in the morning, at night, you can just sit down anytime you need. And I would probably do the entire thing seated, because standing obviously requires more energy. It's a lot less scary to be seated while doing it. So yeah, I think, also I was thinking, this is the brush that you provided for us to use in today's session, but a large paddle brush, like one that's like, I'm talking like huge, that's going to cover a lot more hair. You're not going to have to do as many strokes in your hair. You have pretty thick hair, it looks like, so I would definitely invest in that if you can. But we'll brush your hair first, just like you would. And then I'd probably just continually check her oxygen levels as we go through these tasks. Okay, perfect. And then rest in between if you need to before you move on to your next grooming task, next self-care task. So brushing your teeth, we're just going to do like just the motion of it, and then because we're not seated at an actual sink. So there's the toothbrush, so just go through that, like as long as you would usually have to use it for. And then for brushing your teeth, one way to make it easier is honestly an electronic toothbrush, because it does the work for you. You don't even have to move your hand around at all. And then sitting right there in front of the water basin, just recognizing when you're using up too much energy, using those breathing techniques if you really need to. So that was good. Probably feel a lot better now that you're a little cleaned up for the day. Okay, so then the next functional activity for today is we're going to put a shirt on. We're going to do upper body dressing. So we have a cardigan for you, and I'll explain why we have the cardigan. So with COPD, and your high chance of being short of breath at any part of the day, I would recommend, I know this might be hard, but loose fitting clothing. If you like wearing like zippered or buttons like at the back of something, it'd be best to do without that, because there's a lot of reaching. It's going to be a lot of energy. Cardigans are really easy because you kind of just wrap the cardigan around yourself and then go on with your day. So wearing an undershirt like you are and just putting this on is perfect. So you can kind of make it part of your daily schedule to set your outfit like out at night, so you have that ready to go, and you don't even have to put the energy in with finding an outfit the next day. Don't have to make like excessive trips to your closet or your dresser. So just leave it there right at your bedside. So how does that sound? Do you think all these things I'm telling you could probably do or change?
Yep, definitely get into doing that stuff more.
Okay, awesome. So with this, I'll hand that to you. And I would check her oxygen levels again. Good. Your range of motion looks good. Okay. Probably feel a lot warmer.
Yep.
And you're ready for the day. So awesome. And then that would conclude our session because it's 3 functional activities. So I would again probably just check in, see how she's feeling, and everything like that. So yeah, good job, Sue.